Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Doctor Education. Welcome to my channel again. As you know, I make videos about health and healthcare topics, and all these information are directly referenced from international reference, US National Medical Library. So today's video is based on oral consumption of sandalwood oil. Why it is used, how it is used, what is the mechanism of action of sandalwood oil, what is the content, what exactly is the active ingredient, what are the side effects most importantly, and whether or not you should use it for skin whitening, whether it is effective in weight loss or not, etc., etc. So today I'm going to clear all the myths. People think that they are effective, they are nice, they are good, but bottom line is they are steroids, they are bad. Now how they are good? Let me prove this to you.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
First, you need to understand a few basic things. See, many diseases are characterized by infection, inflammation, and hyperplasia. We have seen the difference between infection and inflammation in some other video, especially of the arthritis video. So infection is when a foreign microorganism enters your body and causes problems. Inflammation is how your own immune system attacks this foreign organism and destroys the local area. This inflammation can happen without this foreign organism also, sometimes inflammatory diseases, right? That's why you have rashes, that's why you have eczema. Then there is something called as hyperplasia. Hyperplasia is the growth of skin tissue or any tissue which occurs in response to diseases, in response to inflammation, in response to certain medicines. Hyperplasia is growth of tissue. Sometimes heart grows, heart becomes bigger. Sometimes scar grows, scar becomes bigger and becomes keloids. So inflammation, infections, hyperplasia are basic characteristics of many diseases, especially skin diseases. And therefore, many herbal products, topical treatments are used and very effectively used in these kind of skin problems. Traditionally, that's why botanical medicines are used, and these botanical medicines often have a complex mixtures of various ingredients, and these all have multiple mechanism of action by which they perform their activity, their function, how they give you benefit if they do. These are being studied, and that's how scientists have studied sandalwood oil, sandalwood album oil, which is also known as East Indian sandalwood oil, which is basically the oil which is taken out from the heartwood of Santalum album tree, distilled from that, which is botanically said to be an essential oil, but it's not basically same as the essential fatty acids which are required by your body. These are essential oils in botanical terms, not in the physiological term of your body. So this oil, sandalwood oil, has demonstrated biological activity in your body. It is seen to be anti-inflammatory, antimicrobial, anti-proliferative. So it acts against inflammation, against infection, against hyperplasia, all three. Wow. So sandalwood oil is so good. So it will act against acne, psoriasis, eczema, common warts, molluscum contagium, and a lot of other skin diseases. It can also be active against arthritis. It can be active against asthma and every single autoimmune disease, every single inflammatory disorder, inflammatory bowel disease. And the studies have shown that it is safe also. It is safe especially to use topically over the skin. And that's why soon pharmaceutical companies have started making pharmaceutical grade sandalwood album oil, and they're going to produce it in a broader use on the basis of novel therapies in dermatology, in skin diseases, especially in skin diseases. And we have seen sandalwood album oil was been and has been used for centuries in Ayurveda, in Chinese traditional medicines. And it is actually good. It actually contains this sandalwood oil from the heartwood of Santalum album tree, contains over 125 different compounds. And it's actually effective, like I said. That's why even the FDA, Australian Therapeutic Goods Administration, has classified this oil as a listed medicine, and it is available as an active ingredient in many non-prescription products in Australia. In US Food and Drug Administration, this oil acts as a natural flavoring ingredient in foods, in some flavors, colors. And yes, it is safe if it is eaten occasionally. That for colors, for flavors, certain specific products. Sandalwood oil is actually so good. But so we all know how rare it is to even find original sandalwood, let alone the oil of the heart. Heart is a small portion in the whole tree, the heartwood of the Santalum album tree. There are like more than a dozen species of sandalwood, but Santalum album and Santalum spicatum are the two main which actually produce these kind of oils in a higher amount, higher concentration of basic active ingredient alpha and beta santalol. Alpha and beta santalol are the basic main ingredients which are present, which are the active ingredients, right? So these woods, Santalum album trees, are actually at the verge of extinction, because obviously we are cutting trees since so long. And do you know, initially these sandalwood oils were actually very widely grown in Indian soil, but because of the destruction they are very less now and very rare now. Australia has started growing them in Quintus, but the point is that it's rare to find original sandalwood oil. But if you do find original sandalwood oil, it is very good anti-inflammatory, very good antioxidant, very good properties for your skin. Now let's talk about these activities. Why is it a very good anti-inflammatory drug? Why it has antioxidant properties? See, sandalwood oil inhibits an enzyme called 5-lipooxygenase, which is an oxidative enzyme which basically produces the pro-inflammatory cytokines and chemokine, and therefore it inhibits pro-inflammatory chemokines, cytokines and PGE2. All these are basically inflammatory mediators, cell communication markers, cell communication cytokines, which are basically the means by which your cells communicate with each other and produce inflammation to fight diseases, to fight infections. And sometimes these are the reason why you get allergic reactions. And that's why we suppress these things to relieve you of that allergies. So that's why sandalwood oil is very good for allergies. You can use it on the skin allergies and you'll see that you get relief. It also plays a huge role in cortisol synthesis. It increases your internal cortisol level, corticosteroid levels. So it increases your steroid, which itself is a big, huge anti-inflammatory product, compound. And this anti-inflammatory effect also suppresses the inflammation. It reduces dermatitis, acne, urticaria, etc. It also helps in patients who have psoriasis. And the alpha xanthalol compound, which is present in the main compound, more than 50% of sandalwood oil is this alpha xanthalol. It inhibits tyrosinase. Tyrosinase is an enzyme which basically is required in the development of melanin. Melanin, as you remember, is a pigment which gives your skin color. So if tyrosin is inhibited, melanin will not be produced. So even if your melanocytes are good, your melanocytes will not be able to produce melanin, and that area where you apply the product sandalwood oil will become white, and it will actually balance the increased activity of melanocytes because of inflammation. So that is also a good effect. That's why it's very good for local application, and that's why it's very good for inhibiting abnormal pigmentations also, which are associated with aging or exposure to sunlight, tanning also. Then coming on to antimicrobial effects, there are some antibacterial effects in this sandalwood album oil. This is seen. Even the most resistant bacteria, MRSA, some of them are sensitive to sandalwood oils. It is broadly active against many gram-positive bacteria and some gram-negative bacteria. And it has also demonstrated activity against some fungal dermatophytes and yeast, including Trichophyton, Microsporums, Candidas, some viruses like herpes simplex virus, influenza virus A, HK, H3N2. But studies are going on right now to see how this happens. Now they think that actually it destroys the cell membrane of the bacteria, of the virus, to actually cause them to die. And it also has anti-proliferative and anti-cancer properties. Anti-cancer effects has been demonstrated in various studies in bladder cancer, in liver cancer, and even in breast cancer. This anti-cancer effect is seen because wherever you apply this locally, what it does, it causes cell cycle arrest, because every cell has a cycle. It goes through a cycle, then dies, and newer cells are formed. And in cancer, what happens? These new cells keep on forming again and again and again. So a lot of cells are formed, and what this does, it causes cell cycle arrest at G2M phase, so that whatever the cells are arrested at this cycle, they destroy, and then new cells are not formed. Apoptosis happens there, and therefore cell death happens. So this happens only in the overgrowing cells. Surprisingly, the normal cells don't show this effect. That's even surprising, but studies are going on. So all in all these are beneficiary effects of sandalwood oil, and it is seen even if you don't apply it, even if olfactory inhalation of sandalwood smell has certain effects, these effects. So it's so strong. It's really strong. So now let's talk about the safety profile. Is it safe? What are the side effects? Some small percentage, like up to 2% of people, can have allergic reactions to this oil. And obviously there are questions to finding pure and original sandalwood oil, because it's very rare. How will you find it? And those who are selling it, whether it's actually pure or not, it's not clear. Now if we talk about the food industry, where sandalwood oil is used as a flavoring agent, where the daily consumption of 0.0074 milligrams per kg is considered safe. More than that, it's high. And this sandalwood oil is being extensively used as a herbal medicine in Asia and widely used in various ingredients, especially in many personal care products and fragrances, at a very low concentration. Very low. It has We have seen the very good effects of sandalwood oil in local application, inhalation, and sometimes in food products also. But is it actually safe to take sandalwood oil for a long time? That's a big question. Now I'm going to be a little contradictory to whatever I said above. Why? Because it's true. Sandalwood oil decreases your body's immunity, increases your body's steroids, and decreases your melanin. So if you use it for a long time, what will happen? Think about it. We have studied steroids before. We have studied melasma before, vitiligo before. We have seen all these things, how side effects can happen because of steroids. On a long term wise, your body will react, especially if you take it daily on a high dose. Especially some doctors are recommending to take sandalwood oil on a daily basis for weight loss. If it is causing weight loss, then think about it, how it is causing. It is causing weight loss because it is increasing cortisol. Cortisol is a steroid which increases sugars inside your body. We have seen in the last episode of second episode of steroids, that cortisol, it uses your muscles, uses your fats, increases your metabolism to increase glucose. And it causes what? Thinning of legs, butts, arms. So people can think they are getting thinner, but it will cause central obesity. Your weight will reduce, weight loss, but you will have central obesity because all the muscles will get converted into fat. So if you are thinking of using sandalwood oil for weight loss, and if you are having weight loss, this is what is happening. You're using your muscles as energy and you are increasing your fats. So sandalwood oil is not supposed to be used for weight loss. It is not supposed to be used for fairness. If you are using it to decrease melanin all over your body, yes, melanin will decrease. We have seen it inhibits melanin production. But as soon as you stop taking sandalwood oil, your melanin will restart. You will become dark again. So you will have to take sandalwood oil for a long time. And if you take it for a long time, your steroids will fuck you up. You will have Cushing syndrome. You'll start having central obesity. We have seen all the side effects which happen with the excess of corticosteroids in the last video. Go and watch the video and understand how taking sandalwood oil for weight loss or for fairness can be so harmful. Sandalwood oil is good as a treatment of inflammatory conditions. For limited amount of time, it is good. Just like steroids are good. We doctors also use steroids to treat these conditions. All these conditions, beclomethasone creams, are used for skin conditions. Steroids are given in arthritis, in asthma, in inflammatory bowel disease to give relief. Same effect is given by sandalwood oil. That does not mean you can use it for weight loss. You can use it for skin whitening. Don't be a fool. Don't be a fool. This is a medicine. It is supposed to be used like a medicine. I hope you're getting my point. So sandalwood oil is very good, but not for weight loss, not for any other thing, only for local skin application. Only if you are prescribed by a doctor for a limited period of time, only then. So don't misuse sandalwood oil. I hope you've understood this. If there is any doubt, I'm going to give the link of this study in the description, and you can watch my steroid videos, all 3 episodes, to understand the correlation. So thank you guys for watching. Do share these videos as much as you can. And as I said before, steroids are very powerful. They will give you instant relief of pain and swelling and arthritis. They will feel like a blessing on first day, on a few days, for a month, but they will cause long-term side effects. To understand, just watch my last video. Thank you so much for watching. I'm Dr. Paramjeet. I'm a consultant physician and cardiologist in Yashoda Super Speciality Hospital. I had to study a lot for this subject because botany is not my subject. but I had to do a lot of research. And that's why I had to make steroid videos before this video, so that you can understand the concept. And if you have not watched the steroid series, then go and watch it first. Then only you will understand the integrity and the intensity of problems you can face if you're using sandalwood oil for weight loss or skin whitening. So thank you so much for watching. Till next time, stay connected, stay healthy. Acne and